Welcome back. Today, we're tackling one of the most tested and most commonly missed NCLEX topics, pediatric growth and development milestones. From social smiles and stranger anxiety to walking, language development, and play behaviors, these questions can be tricky because the NCLEX loves to test small age-related differences. In this quiz, you'll work through 50 high-yield milestone questions designed to strengthen your memory, sharpen your critical thinking, and help you avoid common NCLEX traps. Grab your notebook, answer each question before revealing the rationale, and see how many you can get correct. Let's begin and master pediatric growth and development milestones together. Question 1. A nurse is assessing a healthy 2-month-old infant during a well baby visit. Which developmental milestone should the nurse expect? A. Sits without support. B. Rolls from back to abdomen. C. Social smile is present. D. Uses a pincer grasp. Answer. C. Social smile is present. Rationale. A social smile typically appears around 2 months of age. Sitting without support occurs around 6 months, rolling from back to abdomen around 5 to 6 months, and the pincer grasp develops around 9 to 10 months. Question 2. The nurse is evaluating a 6-month-old infant. Which finding indicates expected gross motor development? A. Walks independently. B. Sits briefly without support. C. Hops on one foot. D. Climbs stairs using alternating feet. Answer. B. Sits briefly without support. Rationale. By approximately 6 months, infants can sit momentarily without support. Independent walking occurs around 12 months. Hopping occurs in preschool years, and alternating feet on stairs develops later in childhood. Question 3. A parent asks when an infant should be expected to transfer objects from one hand to the other. The nurse should respond that this skill usually develops at A. 2 months, B. 4 months, C. 6 months, D. 12 months. Answer. C. 6 months. Rationale. Transferring objects between hands is a fine motor milestone commonly achieved around 6 months of age. Question 4. A nurse is assessing a 9-month-old infant. Which behavior requires further evaluation? A. Pulls to stand. B. Responds to own name. C. Uses an immature pincer grasp. D. Has not developed stranger anxiety. Answer. D. Has not developed stranger anxiety. Rationale. Stranger anxiety commonly appears between 6 and 9 months. Absence of this behavior may warrant further assessment, whereas the other findings are expected at 9 months. Question 5. Which developmental milestone should the nurse expect in a healthy 12-month-old child? A. Speaks in 3-word sentences. B. Builds a tower of 6 blocks. C. Walks with or without assistance. D. Rides a tricycle. Answer. C. Walks with or without assistance. Rationale. Most children begin walking around 12 months. 3-word sentences, block towers, and tricycle riding occur later. Question 6. The nurse is assessing language development in a 15-month-old toddler. Which finding is expected? A. Vocabulary of 4 to 6 words. B. Uses complete sentences. C. Counts to 10. D. Reads simple words aloud. Answer. A. Vocabulary of 4 to 6 words. Rationale. A 15-month-old typically speaks about 4 to 6 words. More advanced language skills develop later. Question 7. A parent reports that their 18-month-old child frequently says no and attempts to do tasks independently. Which interpretation by the nurse is most appropriate? A. Evidence of delayed psychosocial development. B. Expected autonomy development. C. Sign of cognitive impairment. D. Manifestation of separation anxiety disorder. Answer. B. Expected autonomy development. Rationale. According to Erickson, toddlers are in the stage of autonomy versus shame and doubt and commonly seek independence. Question 8. Which milestone should the nurse expect from a healthy 2-year-old child? A. Uses 2-word phrases. B. Writes own name. C. Skips on one foot. D. Ties shoelaces independently. Answer. A. Uses 2-word phrases. Rationale. 2-word phrases are characteristic of a 2-year-old. The other skills develop later in childhood. Question 9. The nurse is assessing a 3-year-old child. Which finding is developmentally appropriate? A. Uses 20-word vocabulary only. B. Rides a tricycle. C. Unable to jump with both feet. D. Requires complete assistance with feeding. Answer. B. Rides a tricycle. Rationale. Riding a tricycle is a classic gross motor milestone for a 3-year-old child. Question 10. A nurse is teaching parents about developmental expectations for a 4-year-old child. Which milestone should be included? A. Plays only alongside other children. B. Copies a circle only. C. Tells imaginative stories. D. Demonstrates object permanence. Answer. C. Tells imaginative stories. Rationale. 4-year-olds engage in imaginative play and storytelling. Parallel play is more common in toddlers. Copying a circle occurs earlier, and object permanence develops during infancy. Question 11. A nurse is assessing a healthy 5-year-old child. Which developmental milestone is expected? A. Uses scissors effectively. B. Walks only with assistance. C. Speaks only in 2-word phrases. D. Cannot identify colors. Answer. A. Uses scissors effectively. Rationale. By 5 years of age, children typically have sufficient fine motor control to use scissors and perform other complex hand movements. Question 12. The nurse is evaluating a 6-month-old infant. Which reflex should have disappeared by this age? A. Babinski reflex. B. Moro reflex. C. Plantar grasp reflex. D. Parachute reflex. Answer. B. Moro reflex. Rationale. The Moro reflex normally disappears by 4 to 6 months. The Babinski reflex may persist until about 1 year, plantar grasp until approximately 8 months, and the parachute reflex remains throughout life. Question 13. A nurse is assessing a 12-month-old child. Which fine motor skill is expected? A. Mature pincer grasp. B. Copies a square. C. Uses scissors. D. Ties shoelaces. Answer. A. Mature pincer grasp. Rationale. A mature pincer grasp is typically present by 12 months and allows the child to pick up small objects efficiently. Question 14. The parent of a 9-month-old infant asks why the child cries when unfamiliar people approach. Which response by the nurse is most appropriate? A. This indicates developmental delay. B. This is a sign of stranger anxiety and is expected. C. This behavior should disappear by 4 months. D. This suggests impaired attachment. Answer. B. This is a sign of stranger anxiety and is expected. Rationale. Stranger anxiety commonly develops between 6 and 9 months and reflects normal social development. Question 15. A nurse is assessing cognitive development in a toddler. Which behavior demonstrates object permanence? A. Looking for a toy hidden under a blanket. B. Riding a tricycle. C. Using a spoon independently. D. Drawing a stick figure. Answer. A. Looking for a toy hidden under a blanket. Rationale. Object permanence is the understanding that objects continue to exist even when out of sight. Question 16. Which statement by the parent of a 2-year-old child indicates normal language development? A. My child uses about 50 words. B. My child speaks in full paragraphs. C. My child cannot understand simple commands. D. My child reads short books independently. Answer. A. My child uses about 50 words. Rationale. By age 2, children commonly have a vocabulary of approximately 50 words and begin combining words into short phrases. Question 17. The nurse is assessing a 3-year-old child. Which play activity is expected? A. Cooperative team sports. B. Parallel play transitioning toward associative play. C. Solitary play only. D. Competitive board games. Answer. B. Parallel play transitioning toward associative play. Rationale. 3-year-olds often engage in associative play, though some parallel play may still be observed. Question 18. A nurse is teaching a group of parents about developmental milestones. Which milestone is expected in a 4-year-old child? A. Hops on 1 foot. B. Rolls over from abdomen to back. C. Crawls independently. D. Pulls to stand. Answer. A. Hops on 1 foot. Rationale. Hopping on 1 foot is a common gross motor skill achieved around 4 years of age. Question 19. The nurse is assessing a school-age child. According to Erickson, which psychosocial task is most important during this stage? A. Trust versus mistrust. B. Initiative versus guilt. C. Industry versus inferiority. D. Integrity versus despair. Answer: C. Industry versus inferiority. Rationale: school-age children focus on developing competence, productivity, and achievement. Question 20. A nurse is evaluating a 15-month-old toddler. Which gross motor milestone should be expected? A. Walks independently. B. Skips on one foot. C. Rides a bicycle. D. Balances on one foot for 10 seconds. Answer: A. Walks independently. Rationale: most toddlers walk independently by 15 months. The other skills occur later in childhood. Question 21. A nurse is assessing a 2-month-old infant. Which reflex should be present? A. Moro reflex. B. Parachute reflex. C. Protective extension reflex only. D. Voluntary grasp reflex. Answer: A. Moro reflex. Rationale: the Moro reflex is normally present at birth and disappears around 4 to 6 months. The parachute reflex develops later, around 8 to 9 months. Question 22. A parent reports that a 6-month-old infant has not yet rolled over. What is the nurse's best initial action? A. Reassure the parent that this is always normal. B. Document the finding and perform further developmental assessment. C. Recommend physical therapy immediately. D. Inform the parent that severe neurological impairment is present. Answer: B. Document the finding and perform further developmental assessment. Rationale: rolling over typically occurs around 4 to 6 months. Further assessment is appropriate before drawing conclusions. Question 23. Which developmental milestone is expected in a healthy 18-month-old toddler? A. Builds a tower of 3 to 4 blocks. B. Copies a triangle. C. Ties shoelaces. D. Writes first name. Answer: A. Builds a tower of 3 to 4 blocks. Rationale: an 18-month-old can usually build a small block tower of 3 to 4 blocks. Question 24. A nurse is assessing a 24-month-old child. Which finding is expected? A. Uses 2-word phrases. B. Speaks in complex paragraphs. C. Reads simple books independently. D. Solves mathematical equations. Answer: A. Uses 2-word phrases. Rationale: 2-word phrases such as want juice are typical language milestones for a 2-year-old. Question 25. The nurse is teaching parents about play activities. Which type of play is most common in toddlers? A. Cooperative play. B. Associative play. C. Parallel play. D. Competitive play. Answer: C. Parallel play. Rationale: toddlers commonly engage in parallel play, playing alongside rather than directly with other children. Question 26. A nurse is assessing a preschool child. Which behavior reflects initiative versus guilt according to Erickson? A. Seeking independence in self-care activities. B. Developing trust in caregivers. C. Creating imaginative games and activities. D. Reflecting on life accomplishments. Answer: C. Creating imaginative games and activities. Rationale: preschoolers are in Erickson's initiative versus guilt stage and enjoy exploring, imagining, and initiating activities. Question 27. Which developmental milestone should the nurse expect in a 4-year-old child? A. Draws a person with several body parts. B. Walks for the first time. C. Uses a pincer grasp for the first time. D. Pulls to stand. Answer: A. Draws a person with several body parts. Rationale: 4-year-olds commonly draw recognizable people with multiple body parts. Question 28. A nurse is assessing a 5-year-old child. Which finding demonstrates expected language development? A. Vocabulary limited to 20 words. B. Uses complex sentences and tells stories. C. Communicates only through gestures. D. Speaks in one-word responses. Answer: B. Uses complex sentences and tells stories. Rationale: 5-year-olds generally have advanced language skills and can tell detailed stories. Question 29. A nurse is evaluating a school-age child. Which activity is most characteristic of this developmental stage? A. Sensorimotor exploration. B. Cooperative play with peers. C. Parallel play only. D. Stranger anxiety. Answer: B. Cooperative play with peers. Rationale: School-age children enjoy organized activities, teamwork, and cooperative play. Question 30. A parent asks when a child should typically be able to state their first and last name. The nurse should respond. A. Around 12 months. B. Around 2 years. C. Around 4 years. D. Around 10 years. Answer: C. Around 4 years. Rationale: by approximately 4 years of age, most children can state their first and last name. Question 31. A nurse is assessing a 9-month-old infant. Which gross motor milestone is expected? A. Walks independently. B. Pulls to a standing position. C. Rides a tricycle. D. Skips on one foot. Answer: B. Pulls to a standing position. Rationale: by 9 months, infants commonly pull themselves to a standing position and may cruise along furniture. Question 32. A nurse is evaluating a 12-month-old child. Which psychosocial behavior is expected according to Erickson? A. Trust versus mistrust. B. Industry versus inferiority. C. Autonomy versus shame and doubt. D. Identity versus role confusion. Answer: C. Autonomy versus shame and doubt. Rationale: around 1 to 3 years of age, children enter the stage of autonomy versus shame and doubt and seek independence. Question 33. A parent reports that a 3-year-old child constantly asks, why? Which interpretation by the nurse is most appropriate? A. This indicates developmental delay. B. This reflects normal cognitive development and curiosity. C. This suggests impaired language development. D. This is evidence of social isolation. Answer: B. This reflects normal cognitive development and curiosity. Rationale: preschool children are naturally curious and frequently ask questions as they learn about their environment. Question 34. Which developmental milestone is expected in a healthy 2-year-old child? A. Copies a square. B. Walks up and down stairs with both feet on each step. C. Hops on one foot. D. Prints letters of the alphabet. Answer: B. Walks up and down stairs with both feet on each step. Rationale: 2-year-olds can usually navigate stairs using both feet on each step while holding a handrail. Question 35. A nurse is assessing fine motor development in a 3-year-old child. Which finding is expected? A. Uses a mature pincer grasp for the first time. B. Builds a tower of approximately 9 to 10 blocks. C. Writes complete sentences. D. Ties shoelaces independently. Answer: B. Builds a tower of approximately 9 to 10 blocks. Rationale: a 3-year-old can build a tall block tower and perform increasingly refined fine motor tasks. Question 36. A nurse is assessing a 4-year-old child. Which finding requires further evaluation? A. Cannot yet ride a bicycle with training wheels. B. Cannot hop on one foot. C. Engages in imaginative play. D. Uses complete sentences. Answer: B. Cannot hop on one foot. Rationale: most 4-year-olds can hop on one foot. Failure to demonstrate this skill may warrant further assessment. Question 37. The nurse is evaluating developmental milestones in a 5-year-old child. Which behavior is expected? A. Copies a triangle. B. Uses only 2-word phrases. C. Displays stranger anxiety. D. Crawls to move around. Answer: A. Copies a triangle. Rationale: by age 5, children can copy geometric shapes such as triangles and demonstrate advanced fine motor skills. Question 38. A nurse is assessing social development in a school-age child. Which activity is most appropriate? A. Parallel play only. B. Solitary play exclusively. C. Team sports and organized group activities. D. Sensoromotor exploration. Answer: C. Team sports and organized group activities. Rationale: school-age children enjoy peer interaction, organized games, and team activities. Question 39. A nurse is teaching parents about Piaget's stages of development. Which stage is associated with a toddler? A. Formal operational. B. Sensoromotor transitioning to preoperational. C. Concrete operational. D. Post-formal operational. Answer: B. Sensoromotor transitioning to preoperational. Rationale: toddlers move from the sensoromotor stage into the preoperational stage as symbolic thinking begins to develop. Question 40. A nurse is assessing a 6-year-old child. Which finding is expected? A. Loss of all primary teeth. B. Beginning of permanent tooth eruption. C. Closure of fontanelles. D. Presence of primitive reflexes. Answer: B. Beginning of permanent tooth eruption. Rationale: around age 6, children begin losing primary teeth and erupting permanent teeth. Question 41. A nurse is assessing a healthy newborn. Which reflex is expected to be present at birth? A. Parachute reflex. B. Moro reflex. C. Protective extension reflex. D. Landau reflex. Answer: B. Moro reflex. Rationale: the Moro, startle, reflex is present at birth and normally disappears by 4 to 6 months. The parachute and protective extension reflexes develop later. Question 42. A nurse is evaluating a 6-month-old infant. Which developmental milestone is expected? A. Stranger anxiety begins to appear. B. Uses 3-word sentences. C. Walks independently. D. Copies a circle. Answer: A. Stranger anxiety begins to appear. Rationale: stranger anxiety commonly begins around 6 months and becomes more pronounced by 8 to 9 months. Question 43. The nurse is assessing a 15-month-old toddler. Which behavior is expected? A. Runs with excellent balance. B. Walks independently and stoops to pick up objects. C. Rides a tricycle. D. Skips on one foot. Answer: B. Walks independently and stoops to pick up objects. Rationale: by 15 months, toddlers typically walk well and can stoop to retrieve objects from the floor. Question 44. A nurse is assessing a 2-year-old child. Which statement by the parent indicates normal development? A. My child uses about 50 words and combines 2 words together. B. My child writes complete sentences. C. My child reads storybooks independently. D. My child can solve simple multiplication problems. Answer: A. My child uses about 50 words and combines 2 words together. Rationale: a vocabulary of approximately 50 words and 2-word phrases are typical language milestones at age 2. Question 45. Which play activity is most appropriate for a preschool-age child? A. Solitary play only. B. Parallel play exclusively. C. Imaginative and cooperative play. D. Sensoromotor exploration only. Answer: C. Imaginative and cooperative play. Rationale: preschoolers enjoy pretend play, role-playing, and increasing interaction with peers. Question 46. A nurse is assessing a 4-year-old child. Which milestone is expected? A. Copies across or simple shapes. B. Uses a pincer grasp for the first time. C. Pulls to stand. D. Rolls from abdomen to back. Answer: A. Copies across or simple shapes. Rationale: 4-year-olds demonstrate increasingly refined fine motor skills and can copy simple geometric figures. Question 47. The nurse is assessing a 5-year-old child. Which developmental achievement is expected? A. Knows only a few colors. B. Cannot distinguish fantasy from reality at all. C. Can count and identify several colors. D. Uses only 1-word responses. Answer: C. Can count and identify several colors. Rationale: 5-year-olds typically count, identify colors, and demonstrate advanced language skills. Question 48. A nurse is evaluating a school-age child. Which psychosocial characteristic is expected? A. Focus on developing competence and achievement. B. Development of basic trust in caregivers. C. Establishment of intimate relationships. D. Reflection on life accomplishments. Answer: A. Focus on developing competence and achievement. Rationale: school-age children are in Erickson's industry versus inferiority stage and focus on mastering skills and achieving success. Question 49. A nurse is teaching parents about developmental red flags. Which finding in a 12-month-old child requires further evaluation? A. Pulls to stand. B. Cruises along furniture. C. Does not sit without support. D. Uses a pincer grasp. Answer: C. Does not sit without support. Rationale: most infants sit independently by 6 to 8 months. Failure to sit without support at 12 months is a significant developmental concern. Question 50. A nurse is assessing a healthy 3-year-old child. Which developmental milestone is expected? A. Rides a tricycle and speaks in short sentences. B. Solves abstract mathematical problems. C. Uses complete adult vocabulary. D. Walks for the first time. Answer. A. Rides a tricycle and speaks in short sentences. Rationale. Riding a tricycle and speaking in understandable short sentences are classic developmental milestones of a 3-year-old child. Congratulations on completing 50 most failed Pediatric Growth and Development Milestones NCLEX Mastery. Pediatric milestone questions are among the most frequently tested and most commonly missed areas on the NCLEX. Success comes from recognizing key age-related patterns rather than memorizing isolated facts. Remember these high-yield rules. 2 months, social smile. 6 months, sits with support, rolls over. 9 months, pulls to stand, stranger anxiety. 12 months, walks with assistance, pincer grasp. 2 years, 2-word phrases, parallel play. 3 years, rides a tricycle. 4 years, hops on 1 foot. 5 years, skips, counts, copies shapes. Keep practicing, stay consistent, and focus on understanding developmental progression. Every question you master brings you one step closer to NCLEX success. See you in the next NCLEX Mastery session.